Hi, my name is Amy Kenneally. I'm part of the U.S. Medical Affairs Organization at GlaxoSmithKline Consumer Healthcare. I'll be the moderator for today's discussion, Ask the Expert, Osteoarthritis. CVS Health is proud to present today's discussion in partnership with the Arthritis Foundation and GlaxoSmithKline Consumer Healthcare. The objectives of our conversation today are to elevate awareness of osteoarthritis and to bring support, education, and resources to the CVS community. And today I have the distinct pleasure of being joined by three panelists who bring a wealth of knowledge to the table regarding osteoarthritis. Today they'll be answering a series of questions about osteoarthritis and offering their thoughts on this debilitating disease. I'd like to go ahead and give each of those panelists an opportunity to introduce themselves. Let's start with you, Kelly.
Hi, my name is Kelly Moran. I'm a nurse practitioner at the Minute Clinic in Philadelphia, and I'm looking forward to today's discussion.
Great, thanks, Kelly. Our next panelist is Rebecca Gillett. Rebecca?
Hi, my name is Rebecca Gillett, and I am the Director of Content Strategy and Planning at the Arthritis Foundation. I'm also an arthritis patient and an occupational therapist, and so glad to be with you guys.
Thank you, Rebecca. And our final panelist is my colleague, Richard Petruschke. Richard?
Hi, everyone. My name is Richard Petruschke. I'm a Director in U.S. Medical Affairs at GlaxoSmithKline Consumer Health, and glad to be a part of the discussion today.
Even though our panelists today come from different facets of healthcare and advocacy, they all have one common goal, and that's to help arthritis sufferers. When it comes to help for arthritis pain, today we'll be talking about Voltaren Arthritis Pain Gel, a topical non-steroidal anti-inflammatory gel that became available for over-the-counter use in the United States in May of 2020. Until its over-the-counter approval, it was available only by prescription in the U.S. Okay, let's go ahead and kick off our panel discussion. And let's start with you, Rebecca. Can you tell us a little bit about your journey as an osteoarthritis patient?
Sure. I was diagnosed at the age of 26 with rheumatoid arthritis, and at that time, I had no idea that people that young could be diagnosed with any form of arthritis. It was a few years later in my 30s where I was diagnosed with having osteoarthritis and degenerative disc disease in my spine. I've since had 3 surgeries on my spine related to my osteoarthritis, and I also have some issues in my knees related to osteoarthritis. So it's been a long journey, a lot of surgeries, and a lot of different ways of trying to find how I can manage the pain of osteoarthritis, which isn't that easy to do.
Wow, that has been quite a journey. And can you tell us, is that the typical journey of an osteoarthritis patient based on your work with the Arthritis Foundation?
Well, that's an interesting question because most people, when they think about osteoarthritis, they're thinking about your typical wear and tear aging arthritis, and so they think it's something you only get when you're older. So is my story typical? Probably not, but it does happen. People of all ages can get osteoarthritis. And one of the things that we do at the Arthritis Foundation is we try to hear what patients say about living with arthritis and what their experience is like. And we conduct surveys to get feedback from patients on what are they doing to manage their pain? Are they finding any relief? And in the past year, we've conducted several surveys in which we've heard back from patients living with osteoarthritis saying they are struggling with this ongoing pain. People describe their pain of living with osteoarthritis as somebody sticking knives into my knees or my shoulder or my hip, or somebody's trying to break my bones or my joints. There's a burning sensation and aching, stabbing pain in my joints that just isn't going away. And it's really physically painful, but the other side of it is that people are also experiencing emotional side effects from dealing with osteoarthritis. 30% of patients report that their osteoarthritis is not well managed, causing significant limitations and a loss of hope for options to treat the pain. So one of the important things that we know is that prompt diagnosis of osteoarthritis is an important step in getting on the right track and finding a treatment plan that works. But a lot of people hesitate and don't go see their doctor when they're having joint pain. So it's important that early on when you start having joint pain, you tell your doctor about it and communicate that so that you can look into and explore different treatment plans.
Wow, thank you, Rebecca. That was some great real-world insight. All right, Kelly, let's pass things over to you. Can you tell us exactly what is osteoarthritis?
Osteoarthritis is the most common cause of arthritis, affecting 30 million adults. and is the leading cause of disability in America.
And Rebecca, can you talk to us about some of the causes of arthritis?
Yes, absolutely. So osteoarthritis, or OA, is caused by a breakdown of the cartilage that protect our joints. And over time, that breakdown of cartilage can cause joint swelling and pain, and bony spurs can develop, which cause more breakdown of the joint, leading to joint swelling.
And who is that typical arthritis sufferer?
There's several groups of people who are at high risk. Age is definitely one of the big factors. So the risk of OA increases with age. Weight can play a factor. So people who have obesity, they increase their likelihood of developing OA. And then genetics and family history definitely play a role. If there's somebody in the family who has a history of OA, then you may be more likely to develop it yourself. Gender plays a huge role. Disproportionately, there's more women than men who develop osteoarthritis. However, it's common at anybody at any age can develop osteoarthritis. One of the biggest myths out there is that OA is only an old person's disease, which we know that not to be true, because you often see people are at risk of developing it when they have an injury or a sports injury. One fact that people often don't know about and are surprised to hear is that our military members get osteoarthritis more than the general population.
Great information, Rebecca. Thank you. All right, I'm going to turn things back over to you, Kelly. Can you talk to us about ways that we might be able to prevent osteoarthritis or slow its progression?
Sure, Amy. Protecting our joints is an important way to prevent the debilitating effects of osteoarthritis. Whenever you're doing any activity, you want to pace yourself, alternating periods of heavy activity with periods of rest. At the same time, if you're sitting for too long, you want to make sure you're getting up, moving around regularly to avoid stiffness. And you want to listen to your body. If you're doing a lot of activity and you have joints that are painful and swollen afterwards, they may be signs that your joints are overstressed. You want to vary your routine, do different things to prevent repetitive motion, take care of your shoes, and ask for help if there's a job that's too big for you to handle on your own.
Great advice, Kelly. Thank you. And what are the common symptoms of arthritis?
Typical symptoms of arthritis are joint pain, swelling, restricted range of motion, and swollen joints. And most of these symptoms occur in the hands, knees, hips, and spine.
Okay. And if a patient has these symptoms and suspects that he or she might have arthritis, what should they do?
If you're a patient experiencing pain, stiffness, and swelling in your joints, you should talk to your primary care doctor or one of the Minute Clinic providers to discuss your concerns. Together, we can formulate a treatment plan that works out best for you.
Awesome. Thanks, Kelly. Rebecca, I'm going to turn things back over to you. Can you talk to us a little bit about how osteoarthritis is treated and managed?
Yes, and one of the things that we know arthritis experts agree on, your first line of defense in managing OA is to adapt healthier habits and lifestyles. So that would include regular exercise, losing weight if you need to lose some weight, to have less stress on those joints, and becoming educated about the disease and its progression and what you can do to ward off more symptoms. One of the other important factors is self-management. One of the things that's key is patient education so that you know how to manage your pain. You have resources and tools you can access when you need them, depending on what your pain is and the issues that you're having. And one of the things that's important as well is addressing your emotional needs. It's hard to be diagnosed with something that you're going to live with for the rest of your life. And connecting with others is an important way to feel like you are not alone in your pain and not isolated in your pain. So building up a support and network of people who know what it's like and know how to support you when you need it with the pain that you're having is so important and key. There are other measures that you can do to manage your osteoarthritis pain, and there are a lot of different non-medical ways to relieve pain. The best approach is being able to combine some of these strategies for different pain relief options. So exercise and weight loss are one of the first lines of defense. Staying active, I like to say motion is lotion. So the more that we move our joints, the more that you are helping keep your joints healthier and warding off any inflammation. So exercise and weight loss combined are the best non-drug therapies available. Having some assistive devices, so braces and canes and things that might help you walk or support your joints when you're performing some kind of activity or task at home, is important to know that you can use them and what's available out there. So talking to your health care provider is important to find the things that will help benefit you. Working with a physical or occupational therapist, those are the best healthcare providers to help you figure out how to adapt your movement, how to adapt tasks that you do without causing more harm to your joints and preventing any pain and supporting the joints that are having pain.
Great. Thanks so much, Rebecca. And I think that really drives home the point of the importance of managing both the physical and emotional impact of this disease. So with that being said, Kelly, I'll turn it over to you to see if you have anything additional to offer on treatment and management for osteoarthritis.
Well, I think what Rebecca touched on about lifestyle changes, healthy diet, exercise, weight management are all really important things that you can do to positively affect your osteoarthritis symptoms. Pain is one of the most difficult parts of this for patients to deal with. Like Rebecca was saying, a lot of people say that their pain is not well managed. And when people are having pain, they tend to be inactive because moving around makes the pain worse. And unfortunately, in osteoarthritis, the less you move, the more the pain is. So it creates this cycle of inactivity and pain. So if your symptoms are not being managed by non-pharmacological treatment methods, there are some pharmacological things that we can do. So non-steroidal anti-inflammatories help reduce joint pain, inflammation, and swelling. Those include ibuprofen, naproxen, and the Voltaren gel relief. Analgesics like acetaminophen can help with pain, but don't really reduce the swelling associated with osteoarthritis.
Thanks so much for the insight, Kelly. I think the discussion around lifestyle modifications is hugely important to this disease state, in addition to the option for medicinal treatments. At this time, I'd like to turn things over to Richard. Can you talk to us a little bit about new treatment options for osteoarthritis?
Sure, Amy, and glad to do that. It's actually 2020 has been a good year for the osteoarthritis sufferer as far as the treatment options, the medicinal treatment options that are available. I think we saw at the American College of Rheumatology annual meeting at the end of 2019 that there's a lot of focus on osteoarthritis. I think in the last 2 years you saw focus was a little more on rheumatoid arthritis, but it seems to be swinging back to osteoarthritis. So there's some good prescription products in development that have moved into clinical studies. And then in the over-the-counter space, there was some novel innovation that reached the market earlier this year. Two key products were Voltaren arthritis pain and Advil dual action. So I'll talk a little bit about those. The first one, Voltaren arthritis pain. It's a new product available over the counter. Previously, it was available as a prescription product for over 10 years, so it has a lot of experience in the hands of the healthcare professionals, and it has real good clinical support. It went through a very extensive clinical development program with several clinical studies, so it's been an osteoarthritis focused product with good support to establish its position in that condition. And then more recently, it was switched over the counter and became the first prescription strength non-steroidal anti-inflammatory gel clinically proven to relieve arthritis joint pain. And it's been in use now for a few months, and it's available for the arthritis sufferer. And the good thing is, as mentioned, you can now purchase that, get it over the counter. So it provides greater access to that product and gives the arthritis sufferer another option in their armamentarium against osteoarthritis. The other product, Advil Dual Action, is another new product that came out more recently than the Voltaren arthritis pain, but it is also novel in that it combines two well-established active ingredients, being ibuprofen and acetaminophen, that individually have been used to treat arthritis, and now puts them together in a new product, single delivery tablet or formulation, so you can take them together. And it has two different mechanisms of action through that combination. It targets pain at the source, and then it also blocks the pain signal with those two active ingredients. So another good option for the arthritis sufferer. And I'll pass it back to you, Amy.
Great. So it's so good to hear that there's this renewed focus on arthritis, Richard, and that there's new treatment options for sufferers. So in regards to Voltaren arthritis pain, can you talk a little bit about how exactly that works or its mechanism of action?
The Voltaren arthritis pain was evaluated in multiple clinical studies and an extensive clinical program looking at both knee and hand osteoarthritis. And they used standard and validated endpoints in those studies to show significant difference from placebo and confirm its efficacy and just establish its safety profile. But what we know is that some of those clinical endpoints and studies don't translate over to being meaningful to patients. So what they did was also look at ways to evaluate those endpoints and bring meaningfulness to the patient. So looking at what was the threshold that need to be met as far as change from initial pain levels and other symptom levels to show a meaningful benefit to patients. And when you looked at those, you saw a significant difference versus the placebo. So again, establishing meaningful endpoints that patient recognized as delivering a benefit. And then they also looked at more quality of life, daily life activity type endpoints, like measures that had to do with things like getting dressed, preparing a meal, and doing different household activities to really make it relatable and what they could achieve with this. And with those types of endpoints, they also saw significant improvement. So really showing that in the osteoarthritis sufferer's life, they could really have a big quality of life improvement using this product.
And in regards to Voltaren arthritis pain gel, Richard, can you talk to us a little bit about what makes it different from other topical and oral pain relievers?
Sure. I think there's a few things I can highlight from the topics I just discussed. So I think a key one is that NSAID as the active ingredient, again, that has those anti-inflammatory properties, and it has those pain relieving, and then differentiates itself from some of the other topical products which are more focused on masking the pain or numbing the pain, but not necessarily getting to the source and treating the pain, would be one of the components. When you think about the format, there are people who would prefer a topical format to oral NSAID, so it gives them that alternative. So now you have an NSAID in a topical format. And then one of the other things is its indication for use compared to some of the other OTC products. It's indicated for up to 21 days of use, which you know when you have arthritis, you get flares or other presentation of the condition where you may need a little more time of use to manage those symptoms. So that 21 days gives them a little more flexibility with their treatment approach.
Thank you, Richard. Really insightful information. So I'm going to take a moment and switch gears and talk about support for arthritis sufferers. So Rebecca, I'm going to turn to you. Can you talk a little bit about the support that's available for somebody who's newly diagnosed and looking for ways to connect with other arthritis sufferers?
That is a great question, because the hardest part in the journey of living with arthritis is when you're newly diagnosed and you're trying to get the pain under control, figure out what your treatment options are, and find some hope, because things might change in how you do the things that you do every day and the way you can live your life based on your joint pain. And so getting connected with other people who understand is important. The Arthritis Foundation has the Live Yes Arthritis Network, and it's a community that's full of people who have arthritis, experts who can weigh in on information and suggest ideas and give you treatment plan ideas. Also, resources and tools to learn how to manage your pain and live a better life. Getting connected to a community of people who understand is really important in this process.
Thanks, Rebecca. That's great information for our viewers, since support is such a big part of this disease. And Kelly, do you have any recommendations as far as resources?
I'm going to agree with Rebecca on this one. Arthritis Foundation website has some great resources for patients. You can also visit minuteclinic.com to see more about the services that we provide.
And Richard, do you have any recommended resources for our viewers?
Yeah, thanks for asking, Amy. We have a Voltaren brand website that's available for consumers to access. And one of the unique things about it is it's an arthritis-friendly website that we developed in partnership with the Arthritis Foundation. It has its seal of approval on that status. We also have a GSK Health Partners website, which is accessible for healthcare professionals who are listening to this broadcast and interested in getting information about our pain and other products. And then we do have social media channels that are available for our consumers to engage with us and ask questions or share information. We really appreciate hearing from the consumers about the products and any other ways we can support them in managing their osteoarthritis. So lots of channels, and look forward to hearing from the consumer population.
Kelly, can you talk to us a little bit about why CVS is interested in helping the arthritis patient?
CVS has long been committed to supporting their patients on their path to better health and helping to manage chronic conditions like arthritis. So if patients are experiencing any symptoms, they can come into the Minute Clinic and talk to a provider. We also have new health hubs that have expanded products and over-the-counter remedies for arthritis pain. In addition, CVS has been a longtime supporter of the Arthritis Foundation.
Thanks, Kelly. All great news for arthritis sufferers. This brings us to the end of our Ask the Expert osteoarthritis discussion. I'd like to extend a sincere thanks to our panelists for their insight and participation today. I'd also like to thank our viewers joining us from home. For more information on osteoarthritis, check out our partners' websites below or visit your neighborhood Minute Clinic or CVS pharmacy. Thank you.